Imagine this for a moment. You've been taking a small pill every day for years. Your doctor once said it was safe. Your friends take it. Your neighbor swears by it. But now, cardiologists are quietly sounding the alarm because new evidence suggests this very pill be putting aging hearts under serious stress. Not overnight, not dramatically, but slowly, silently, and dangerously. As we get older, the heart changes. It stiffens slightly, blood vessels lose some elasticity. Recovery takes longer, that's normal aging. But what's not normal is when something we take daily begins to amplify those changes without us realizing it. And that's exactly why doctors are shocked. This pill doesn't cause sudden pain or an immediate reaction. Instead, it works in the background, subtly interfering with how the heart and blood vessels function over time. Here's what makes this so concerning. Many older adults take daily medications believing that if a pill is common, widely prescribed, and approved, it must be harmless. And in many cases, that's true. But the human body at 60, 70, or 80 years old does not respond the same way it did at 40. The heart, especially, becomes far more sensitive to chemical signals, electrolyte balance, and inflammation. Cardiologists began noticing a pattern. Older patients with no prior major heart disease were showing worsening blood pressure control, irregular heart rhythms, unusual fatigue, and reduced exercise tolerance. When doctors looked closer, they found something many of these patients had in common: long-term use of this specific daily pill. At first, it didn't seem logical. The medication wasn't new. It wasn't experimental. It had been used for decades, but that's exactly why it flew under the radar for so long. Early clinical trials often focus on short-term outcomes and younger populations. Long-term effects on aging hearts sometimes only become clear after millions of people have taken the drug for years. One cardiologist described it this way: "It's not that the pill is toxic. It's that aging hearts can no longer tolerate the hidden strain it creates." So, what kind of strain are we talking about? To understand this, we need to talk about how the heart stays healthy. Your heart relies on a delicate balance of minerals like sodium, potassium, and magnesium. These control electrical signals that keep your heartbeat steady. Even small disruptions can increase the risk of arrhythmias or irregular heartbeats. Some daily pills subtly alter this balance, especially when taken long-term. In younger bodies, the kidneys and cardiovascular system can usually compensate. But in older adults, that safety margin shrinks. Over time, the heart may begin beating less efficiently, pumping slightly less blood with each beat. You may not feel it at first, but months or years later, it can show up as breathlessness, swelling in the legs, dizziness, or unexplained weakness. Another issue cardiologists are worried about is chronic inflammation. Low-level inflammation is already more common as we age. Certain medications can increase inflammatory markers in the body, placing extra stress on blood vessel walls. This makes arteries stiffer, raises blood pressure, and forces the heart to work harder just to do its job. Think of it like driving a car with slightly thickened oil. The engine still runs, but it wears out faster. Doctors also discovered that this pill may interfere with how the heart muscle uses energy. The aging heart is already less efficient at converting oxygen and nutrients into power. When a medication disrupts this process, even slightly, the heart can become fatigued over time. This doesn't cause immediate heart attacks, which is why it's often missed. Instead, it slowly weakens the heart's resilience. What truly shocked cardiologists was how many seniors had never been told about these risks. Many were never reevaluated after starting the medication years ago. Their prescriptions were simply renewed again and again without considering how aging had changed their bodies. This raises an important point that heart doctors emphasize again and again. A medication that was right for you at 50 may not be right for you at 70. And this pill is a perfect example. Some patients reported subtle signs long before any diagnosis: trouble climbing stairs, feeling unusually tired after simple activities, occasional fluttering in the chest. These symptoms were often blamed on just getting older. But when cardiologists reviewed medication histories and adjusted or discontinued this pill, many patients experienced noticeable improvement within weeks. That's when doctors realized this wasn't a coincidence. Now, it's important to be clear. Cardiologists are not saying that everyone should panic or stop their medication suddenly. In fact, stopping certain pills without medical guidance can be dangerous. What they are saying is far more important. Aging hearts need closer attention, and some medications deserve a second look. One of the most alarming discoveries came from long-term observational studies. Seniors taking this pill daily had a higher likelihood of developing heart rhythm issues compared to those who didn't, even when other risk factors were similar. This association became stronger with age, especially after 65. That finding changed how many heart specialists think about routine prescriptions. The truth is, the heart doesn't speak loudly when something is wrong. It whispers first. And this pill seems to muffle those whispers, delaying warning signs until the damage is already underway. Doctors are now urging older adults to ask better questions. Why am I still taking this? Do I still need the same dose? Are there safer alternatives for my age? These conversations can be life-changing, even life-saving. To understand how this pill became so common, we need to go back to when it first entered everyday medicine. At the time, it solved a real problem. It relieved symptoms, improved comfort, and in many cases, helped people live more normal lives. Doctors saw clear benefits, and for short-term use or in younger adults, it appeared safe and effective. That reputation stuck. As years passed, the pill became routine. It was prescribed quickly, refilled easily, and rarely questioned. For many older adults, it became part of the morning habit, taken with breakfast without a second thought. And because serious side effects didn't show up immediately, no one suspected it could be quietly affecting the heart. But aging changes everything. As we grow older, the liver and kidneys slow down. This means medications stay in the bloodstream longer. Even normal doses can build up over time, leading to higher exposure than originally intended. Cardiologists now believe that this slow accumulation is one of the key reasons aging hearts are more vulnerable. Another factor is drug interaction. Many seniors take multiple medications each day. This pill, when combined with common blood pressure drugs, heart medications, or even certain supplements, can intensify its effects on heart rhythm and blood vessels. Alone, it may seem harmless. Together, it can become a problem. Doctors began seeing patients whose heart tests didn't quite make sense. Their arteries weren't severely blocked. Their cholesterol wasn't extremely high, yet their heart function was declining. When cardiologists started removing variables one by one, the pattern kept leading back to this daily pill. One of the biggest warning signs was changes in heart rhythm. The heart relies on precise electrical timing. This pill appears to interfere with that timing in older adults by altering nerve signals and mineral balance. Over time, this can trigger skip beats, palpitations, or more serious rhythm disorders. Many seniors described it as a flutter, a pause, or a racing sensation that came and went. Because it wasn't constant, they ignored it. But cardiologists know that intermittent rhythm problems can still increase the risk of stroke and heart failure if left untreated. Another issue is blood pressure instability. Some older adults on this pill experience sudden drops in blood pressure when standing up, leading to dizziness or falls. Others had the opposite problem, rising blood pressure that became harder to control despite medication. Both scenarios strain the heart and increase cardiovascular risk. What makes this especially dangerous is how easily these symptoms are dismissed. Fatigue is blamed on age. Shortness of breath is blamed on being out of shape. Lightheadedness is blamed on dehydration. But when cardiologists looked deeper, they found that adjusting or discontinuing this pill often improved all three. There's also growing concern about how this medication affects the inner lining of blood vessels, known as the endothelium. Healthy blood vessels expand and contract smoothly. In aging adults, this function is already reduced. Certain pills appear to worsen this stiffness, making it harder for blood to flow efficiently. The heart must pump harder, beat after beat, year after year. This extra workload doesn't cause pain right away. Instead, it slowly thickens the heart muscle, particularly the left ventricle. While a thicker muscle might sound stronger, it actually becomes less flexible and less efficient over time. Cardiologists recognize this as an early step toward heart failure. What shocked many doctors was how reversible some of these changes were. In patients where the pill was no longer necessary, gradual withdrawal under medical supervision led to improved energy, steadier heart rhythms, and better exercise tolerance. This strongly suggested the pill was not just associated with the problem, but contributing to it. That doesn't mean the pill is always harmful. It means the risk-benefit balance shifts with age. A medication that once helped can quietly become a burden on an aging heart. Cardiologists are now emphasizing regular medication reviews, especially after age 60. They recommend reassessing long-term prescriptions every year, even if there are no obvious side effects. The goal is not to remove helpful treatments, but to ensure the heart isn't paying an unnecessary price. Perhaps the most concerning finding is how few seniors are informed about these risks. Many were never told to watch for heart-related symptoms. No one explained that the pill could affect rhythm, blood pressure, or heart muscle function over time. Without that knowledge, early warning signs go unnoticed. And that's what doctors find most troubling. The heart often gives subtle clues before serious damage occurs. A change in stamina, a new sense of heaviness, a feeling that something just isn't right. When these signs are ignored or misattributed, the opportunity for early intervention is lost. So what do cardiologists actually want older adults to do with this information? Not panic, not throw away medications, and definitely not stop anything suddenly. What they want is awareness, conversation, and timing. The first and most important step is recognizing that the body you have today is not the body you had decades ago. Aging hearts respond differently, they recover more slowly. They tolerate stress less efficiently. That means every long-term medication deserves a second look, especially ones taken daily for years. Cardiologists recommend that seniors pay close attention to subtle changes because the heart rarely announces trouble loudly at first. One of the earliest red flags is unexplained fatigue. Not the normal tiredness after a long day, but a deeper exhaustion that feels out of proportion to the effort you're making. If simple activities start feeling harder than they used to, the heart may be struggling. Another warning sign is shortness of breath during routine tasks. Walking, climbing stairs, or even getting dressed should not suddenly feel difficult. When the heart can't pump efficiently, oxygen delivery suffers, and the body notices before tests always do. Heart rhythm changes are another key signal. A fluttering sensation, skipped beats, pounding in the chest, or a racing heart that appears without exertion should never be ignored, especially in older adults taking long-term medications. These symptoms don't always mean something dangerous is happening right now, but they are messages the heart is sending. Swelling in the ankles or feet can also be a clue. It often indicates that the heart is having trouble moving blood forward efficiently, causing fluid to back up. This can develop slowly and painlessly, making it easy to overlook. Cardiologists stress that none of these signs should be brushed off as just aging without evaluation. Aging is normal, silent heart strain is not. Doctors also encourage older adults to request a full medication review at least once a year. This includes prescription drugs, over-the-counter pills, and supplements. Many people are surprised to learn how certain combinations can increase cardiovascular stress. What matters is not just what you take, but how everything interacts inside an aging body. In many cases, cardiologists find that the dose can be lowered, the medication can be switched, or, in some situations, it may no longer be needed at all. These adjustments are made gradually and carefully, always prioritizing safety. What's important is that the conversation happens. Another major focus for heart doctors is lifestyle support. When medication strain is reduced, the heart responds better to simple, protective habits. Regular gentle movement improves circulation and strengthens the heart muscle. Staying hydrated helps maintain healthy blood pressure and electrical balance. Adequate sleep supports heart rhythm stability. Even small improvements can make a noticeable difference once unnecessary stressors are removed. Cardiologists also emphasize monitoring. Simple tools like home blood pressure checks or periodic heart rhythm evaluations can catch changes early. Early detection gives doctors more options and reduces the risk of serious complications. Perhaps the most powerful message doctors want to send is this: common does not always mean harmless, especially over time. Medicine evolves, new data emerges, and what was once considered routine can deserve reevaluation as science advances. The reason doctors are shocked isn't because this pill is evil or malicious. It's because its long-term effects on aging hearts were underestimated for far too long. And now, with clearer evidence, cardiologists are trying to close that gap before more silent damage occurs. The heart works tirelessly, every second of every day, for decades. It deserves careful protection, especially later in life. Paying attention, asking questions, and staying informed are not signs of fear. They are signs of wisdom. This conversation isn't about one pill alone. It's about respecting how aging changes the body and responding with care instead of habit. When seniors are empowered with knowledge, outcomes improve, lives improve, and hearts stay stronger, longer. The most important thing to remember is this: your heart has carried you through decades of life. Every joy, every struggle, every quiet moment, it doesn't fail suddenly without reason. Most of the time, it gives warnings long before serious trouble appears. The danger comes when those warnings are ignored, misunderstood, or masked by routines we never stop to question. This pill didn't become a concern overnight, and it doesn't harm everyone the same way. But cardiologists now agree on one thing: aging hearts deserve more attention, not assumptions. What worked years ago may need adjustment today. And there is no shame in revisiting old prescriptions with fresh eyes. If you or someone you love has been taking a daily medication for years, let this be a reminder not of fear, but of responsibility. Talk to your doctor, ask questions, share symptoms, even the small ones. Medicine works best when it evolves with the person taking it. Your heart is not replaceable. It's not something to gamble with or ignore out of convenience. Protecting it doesn't mean rejecting treatment, it means choosing the safest, smartest path forward. Stay informed, stay aware, and most of all, listen to your heart because it's been listening to you your entire life.